Hi, I'm Silas reporting from the 1800s. I'm here to talk about the healthcare of this time. I'm also here to talk about a famous doctor named Dr. Wilfred Grenfell. There were lots of poor people who died young because of diseases we no longer hear much about, like scarlet fever, smallpox, and tuberculosis. Instead of relying on doctors giving them modern medicines like penicillin and vaccines, they had to rely on more basic medicines like herbal remedies made by family and friends. Many people died at a very young age because of the lack of doctors and medicine. The doctors only had one textbook of information to learn. Dr. Wilfred Grenfell started a new era of healthcare in Newfoundland during the late 1800s. Here is Dr. Grenfell seeing a sick patient with tuberculosis. He likely traveled to see patients by dog team or by boat.
Well,
what is it like to be a doctor in the 1800s?
well, hello, future Silas. Compared to your time, it's very challenging for us doctors. As we didn't have lots of fancy medicines, we usually used herbal remedies. We also didn't have fancy blood work or machines to monitor patients. And as a result, we had to rely mostly on our clinical skills to help patients.
As you can see, medical care here was very hard and it was mostly for comfort. So, Dr. Grenfell, what are you doing right now with your patient?
My patient right here actually has tuberculosis. A lot of people in this time had this condition. He's actually quite sick. Let me just check your pulse, sir. Oh, no. I'm so sorry.
It's too bad.
It is.
As you can see, healthcare here is pretty basic. There's not much you can do when somebody gets a sickness or disease like tuberculosis. Very sad. Healthcare today would not exist as the way we know it if it wasn't for doctors like Dr. Wilfred Grenfell. As you can see, healthcare has advanced a lot in the last 200 years. This is Silas reporting. Good night.